Now, we do have a way to monitor the efficiency of our heart and our circulatory system. These are called vital signs. When you go to the doctor, the first thing they're going to do is triage you. They're going to take a temperature. They're going to take your heart rate. They're going to take blood pressure, right? And so we say our vital signs are all of the things I just listed, but it's also going to include your pulse and your blood pressure for this chapter. So let's look at pulse. Remember, pulse is caused by the recoil of arteries. So 120 over 80, it's that pressure change that gives us a pulse. We can take a radial pulse. Radial pulse, remember, we take it at the wrist, down by the thumb side, that's where the radius runs, that bone. A normal male pulse is about 66 beats per minute when laying down, about 70 beats per minute when sitting up. If you stand up quickly, your pulse will go up, and when you exercise, it's even higher, right? Now, we also have some pressure points, and pressure points are anywhere in your body where your arteries are kind of close to the surface, and you can compress a pressure point to stop blood flow. So pressure points are going to be like here in the neck where the carotid arteries are. We have some down in the groin, the femoral artery runs there. It's a little more superficial. So if someone has a wound and they're bleeding quickly, it's important to be able to apply a tourniquet or to be able to put enough pressure to help try to stop some of that blood flow. Here are some of the pressure points. I mentioned the femoral artery and the carotid arteries, but there are some other pressure points as well. This one down at the bottom, the dorsalis pedis artery. Sometimes if you're in the hospital, they may even take your pulse down here on the foot, especially if somebody has maybe a leg wound. They may, like, let's say they have a wound here on their left leg. The nurse might come in while they're in the hospital and constantly check their pulse down here. Why? Why would it be important to check a pulse if you've got a wound up here? Yeah, just making sure that you're getting the blood flow down past that wound, right? So depending on what that patient is in the hospital for, we may have to take a pulse in different areas of the body. Now remember, we took a blood pressure in labs. You have had some practice taking blood pressure. We take a blood pressure using what's called the oscillatory method. This is where we listen with a stethoscope, and then we use a dial called a sphygmomanometer. And we read the numbers on that dial while we listen. When we are taking a blood pressure, what you do is you put the cuff on, you put the stethoscope and listen to that pulse point, that pressure point in the antecubital region. You pump the cuff up until it exceeds the systolic pressure. So if a normal pressure is 120 over 80, you would pump the cuff up to maybe 140. Okay? You want to get it higher than 120. The reason is you basically want to cut off blood supply. Okay? So you want to put enough pressure on it to stop the blood flowing through that artery. Then you're going to slowly release the pressure until you can start hearing blood flow. You're going to hear a pulse. And when you hear that, you know, oh, that is the pressure that we have running through those arteries. That's going to be the high number. And so we call that the systolic pressure. Okay, normal systolic pressure is 120 millimeters of mercury. And then you keep letting the pressure off the cuff until eventually the blood is flowing freely and you are not hearing that pulse anymore. And at that point, when you stop hearing something, we call that the diastolic pressure. That's the low pressure. And a normal diastolic pressure is 80. Now, sometimes we can see changes in blood pressure. Posture can make a difference in your blood pressure. I have really low blood pressure. My husband always jokes with me. My blood pressure is usually like 100 over 60 or like 110 over 60. But I will, if I'm like bending down doing something, or if I'm helping my child like tie his shoes or doing something on the ground and I stand up too fast, I will see spots. I have to hold on to something. so I don't fall over. And that's normal. You'll see changes in your blood pressure if you change elevations quickly. Also, physical exertion. When you exercise, your blood pressure may change. The reason, let's go back to this equation. The reason is when you exercise, what happens to your cardiac output? It goes up. So what do you think is going to happen to your blood pressure? It is going to go up. Okay, so we will see a rise in your blood pressure when you're exercising. Emotional upset, even fever, when you're running a fever, that can also influence your blood pressure. It can be a little elevated. Other things might be how old you are, whether you're male or female can play a role in your blood pressure, your weight. Race can play a role in blood pressure. So African Americans, a lot of times will have higher blood pressure than Caucasians. Mood, you're angry. You're super angry, your blood pressure may go up, right? You heard people say that, like, oh, you're making me mad, you make my blood pressure go up, right? That's true. If your mood changes, your blood pressure can change. And like I mentioned, so can posture. High blood pressure is called hypertension. Remember, hyper means above or more than normal. So this is a sustained, elevated pressure higher than 140 over 90. Okay, so 140 over 90 or higher is considered hypertensive. Now, pre-hypertension would mean that your blood pressure is elevated, it's higher than 120 over 80, but it's not as high as 140 over 90, right? Now, again, pre-hypertension can be transient. If you go to the doctor and you're not feeling well and you're running a fever, your pressure might be high, it might be elevated. So going to the doctor and having an elevated pressure one time, they're not going to throw you on any kind of blood pressure medication right away. Before they do that, they'll probably say, go buy a blood pressure cuff and record your pressure for the next 2 weeks or so. And that's really important. Once you go on blood pressure medicine, you're on it for a while. So you definitely, that's not something you just want to go on. Another thing, remember, is that your mood can affect your blood pressure. So there are people who have, they call it white coat syndrome. They get scared when they go to the doctor's office, and that's going to cause their pressure to go up. So again, a doctor should tell you, hey, take your blood pressure at home when you're relaxed, and let's make sure it's not high just because you're here seeing me. Okay. Now, high blood pressure that is prolonged is, sometimes we call this sort of a silent killer. And the reason is because it puts a lot of pressure on your heart, a lot of pressure on your capillaries, your vessels, which normally we should have a lower pressure running through them. Even in places like your kidneys, it's going to put a lot of pressure on your kidneys. So high blood pressure causes your heart to have to work a lot harder. Remember, your heart muscle is not like skeletal muscle. If it works harder, it doesn't get stronger, it gets flabbier. So you don't want that. Also, high blood pressure accelerates atherosclerosis. So remember, atherosclerosis is hardening of the arteries. We usually see it with poor diet. And so when you have high blood pressure, it can lead to things like atherosclerosis, and it can cause problems with tissue perfusion. It can cause problems in organs like the retinas and the kidneys and the heart and the brain. 90% of the time, people with high blood pressure have something called primary hypertension. This means there is no underlying cause. Risk factors for primary hypertension a lot of times are genetics. So if your mom's side of the family or dad's side of the family has high blood pressure, there is a strong chance that you might have it as well, even if you're thin, even if you're healthy, even if you exercise. So heredity, diet plays a huge role. Diets high in saturated fat can lead to hypertension. Obviously, obesity, as you get older, hypertension can be a problem. Type 1 and type 2 diabetes, stress, and smoking. So all of those are things that are risk factors that can cause high blood pressure. There is no cure. but it can be controlled different ways. One would be restrict the amount of salt that you're taking in. Why would you need to restrict your salt if you have high blood pressure? What happens when you eat food that has a lot of salt in it?
You're saying water?
Yes, ma'am. Like, I love Mexican food, but really I like the chips at the beginning before you get your food. I usually fill up on those, chips and cheese. If you eat a lot, like when I go to Mexican food, I notice the most when I have Mexican food. The next day, I cannot put my wedding ring on my finger. Like, my fingers are swollen. When you eat salt, you retain water. So one rule of thumb, and we're going to talk about this semester as we go through some other chapters, water follows salt. So the more salt you take in, the more water you're going to hold on to. And remember, if you increase blood volume, what happens to blood pressure? Goes up, right? So people who have high blood pressure, one thing they can do is cut down on their salt intake. Also, saturated fat intake and cholesterol intake. Exercise more, lose weight, stop smoking, all the things you know you're supposed to do. And then if those don't work, then you would take blood pressure medication. Now, secondary hypertension is much less common. This is typically caused by another disorder. So this might be the renal arteries are blocked and your kidneys are unable to filter through your blood and release water in your urine. So you're holding on to water that's causing a blood pressure to go up. But we know there's a problem. There's a problem with the kidneys. So problems with the kidneys, whether it's kidney disease or problems in the renal arteries, or even hormones that affect the kidneys. So any kind of endocrine disorder, like hyperthyroidism and Cushing's disease, all of these affect the kidneys and your water balance. So they're going to play a role on blood volume and blood pressure. The treatment for secondary hypertension is let's fix the problem that's causing it. Okay? So if there's something going on with the kidneys, if that gets fixed, the hypertension goes away. Hypotension is the opposite. This is a low blood pressure. So blood pressure below 90/60. Usually it's not a concern. It's only really a problem if your blood pressure is so low that you cannot perfuse your tissues. You cannot get oxygen and nutrients to your tissues. Or if you're dizzy or you faint a lot, then it's a problem. It's affecting your life. But typically they say that a lower blood pressure actually is associated with a longer life and less cardiovascular diseases. Now, a couple of imbalances that we'll see with low blood pressure. Again, remember, hypo means below. So a couple of imbalances that we'll see. Is orthostatic hypotension. This is a temporary low blood pressure when you stand up too quickly. So you go from kind of like kneeling to standing up, or from sitting to standing up really fast, your blood pressure can drop. Chronic hypotension, this is long-lasting low blood pressure. A lot of times this might be, maybe you're not eating well, maybe you're dehydrated, maybe you have an underlying condition like Addison's disease or hypothyroidism. And then acute hypotension, remember the term acute means sudden onset. This is a sign of circulatory shock. So this would be someone is bleeding out. Bleeding out, you're losing your blood volume, blood pressure is coming down. That's called acute hypotension. This is a huge threat for surgical patients. So when they're being cut open, or patients in the ICU. So a lot of times if a patient is losing a lot of blood, let's say paramedics get to a scene and a patient has lost a lot of blood and their blood pressure is tanking, they will immediately give them Ringer's solution, saline solution. Doesn't even matter if it's blood, let's just give them solution so that we can get their blood volume and blood pressure back up, okay?